I'm Dr. Rita McGuire. I'm the Chief Medical Officer for Wakana, as well as one of the co-founders here. Tonight, we have a special guest, Erica Zachary. She's a licensed clinical social worker who is part of our topic. Why? Because she is someone that has been diagnosed and is living with multiple sclerosis. We're also going to talk about how this disease affects mental health, since it's Mental Health Awareness Month. The whole month of May, I'll be combining our topics with mental health and how CBD can be part of our wellness products to have a more holistic, natural, organic way of addressing our challenges. So we're going to get started. We're going to talk a little bit about Wakana and our founders here. We're the only minority female-owned CBD company in Illinois, and we are so excited. We are a year old. We just launched a year ago in April 20th, and we have a amazing dynamic CEO who is the visionary behind Wakana. Melissa Boston brings over 29 years of experience in the direct sales industry. She also has a lot of expertise as a social media strategist. But more than that, Melissa Boston has trained over 50,000 distributors. She has built over 40 companies in over 40 countries. And she truly, truly is our visionary behind Wakana. Dr. Patricia Van Pelt is our president. She is a state senator. She is serving her third term here in Illinois. She's also an evangelist and businesswoman. Phyllis Nash, our senior VP of sales, brings over 30 years in sales experience in sales. She actually put Leon Barbecue on the map. She is what we affectionately coin our midwife, where she births all of the sales possibilities here at Wakana. And then myself, Dr. Rita McGuire, I'm the Chief Medical Officer. I bring to you over 30 years in the healthcare profession. I'm an obstetrician gynecologist. In fact, I'm here on call. It seems as though every Wednesday I have a mall-tip. That's a woman that's had more than 2, 3, 4. This is her 7th baby, right? And she's 4 centimeters. So we're going to pray that she does not deliver while we're on the call. But all 4 of us have been in the cannabis industry for the last 3 years. We're pioneers, we're experts in the space, and we are truly excited to lock arms with you on this line to really help us spread the word about this movement, because this is more than a CBD company. We are a movement. And our vision is that we really exist to help end the negative stigma. Because when you say the word cannabis, the first thing that comes to many of our minds is getting high and weed. So our vision is to end the negative stigma that has caused communities around the world to suffer and lose out on the health and wealth benefits of the cannabis plant. And our mission is that we are the catalyst to stir a movement that really inspires people like you on this webinar to confidently move into the legal space as entrepreneurs, as formulators, as investors, evoking the courage and strength of people to really take back their health, wealth, legacy, and freedom. So when we talk about CBD or cannabidiol, it truly has become one of the most popular organic, holistic, natural compounds that people are using. And the number one reason people are using CBD today is for pain. Number 2, anxiety. Number 3, I would say insomnia. So CBD offers many, many health benefits without the high that THC will give you. So when we look at the plant, when we look at the cannabis plant, It is the family, and this family has two species. It has the marijuana species, that's the species that gives you high, and then it has the hemp species. The hemp species is defined as containing less than 0.3% of THC. So let's talk about the compounds that the cannabis plant makes. There's over 100 compounds. The two most popular ones are THC, or delta 9 tetrahydrocannabinol. That's a compound that gets you high. And then the CBD, cannabidiol, that's the product that gives you the health benefits without the high. So tonight we're going to concentrate on CBD that's extracted from the hemp species. That's a species that contains a large percentage of CBD that gives you the health benefits and very trace amounts, 0.3% or less of THC. That's the compound that gives you the high. So when we speak about multiple sclerosis, it's really important that you understand that there are certain disease states, chronic states, that really benefit from using a full spectrum product. That is a product, when we say full spectrum, that uses the whole plant. It uses those important cannabinoids or compounds that you see here, the terpenes, the flavonoids, the whole compound, so we get that entourage effect, that effect that gives that synergy where we get results when we're using it in chronic illnesses. So let's concentrate on some of the benefits CBD can give to those who have multiple sclerosis, because that's what we want to concentrate on tonight, right? So CBD is neuroprotective, and we're going to learn all about multiple sclerosis in a minute, but it is a protection of our nerve fibers. It helps to protect those who have multiple sclerosis, who have Parkinson's, who have dementia, and even strokes. CBD also reduces the function of the immune system. And because multiple sclerosis, you'll learn, is an autoimmune disease, and an autoimmune disease is a disease that has a very hyper reaction to the immune system. So it helps to put the immune system back in balance. CBD also reduces pain, relieves pain and inflammation, another big symptom that we'll learn about that multiple sclerosis has, and it relieves anxiety. And we're going to talk about the mental health benefits as well. Let's look at THC. Now, THC is very important when we're talking about multiple sclerosis because THC helps to suppress the muscle spasms. It helps to relieve pain. So you can see how important it is to have the whole plant. We look at CBG, it aids in sleep. We look at CBC, it helps to relieve pain. So all of these compounds that the plant makes, we want when we're dealing with those with multiple sclerosis. So how does it work? How does CBD and THC and CBC and CBG, how do all of these compounds work in the body? And it works by a system called the endocannabinoid system. And this system is found in every vertebrae. If you have a spinal cord, you have an endocannabinoid system. And this system is deemed one of the most vital regulatory systems that the body has receptors in the brain, in the central nervous system, in the periphery, in the immune system. These receptors are looking for cannabis. These receptors are looking for CBD and THC and CBC and CBG. They're looking to put the body back in balance. They're looking for these compounds to decrease inflammation. They're looking for these compounds to decrease pain, anxiety, and depression. So this system is a system that keeps our body stable, in balance. It controls our mood, our metabolism, our sleep cycles, how we think, how we react. These receptors are found in the eyes. You'll see how important it is that these receptors are found in the eyes, in the lungs, in the liver, in the kidney, in the bowel, in the skin, in the stomach, in the teeth, and the heart. So what is multiple sclerosis? Well, multiple sclerosis is a neurological disease that affects the central nervous system. And the central nervous system is made up of the brain, spinal cord, and optic nerves. Now, within the central nervous system, the immune system causes inflammation that causes damage to the myelin. The myelin is this fatty substance that surrounds and insulates our nerves. So you can see in a healthy nerve or neuron, the insulation is there. And then in those that are affected by multiple sclerosis, it's damaged and worn. And so the cause of multiple sclerosis is really unknown. They think there may be a genetic, an environmental factor. When we talk about this COVID-19 virus, there's even studies that show maybe it was a viral infection that triggered multiple sclerosis to occur in a person. But what we do know is that it is an autoimmune disease where the body's immune system is attacking its own tissue. It thinks it's foreign and it starts attacking. In addition to the insulation around the nerve fibers are now exposed. And with that exposure, they cause scarring in multiple areas. So that's where the name comes from, multiple sclerosis. So there are different types of multiple sclerosis. The most common type is called a relapsing remitting type. That's when you'll have areas where a person is in remission and then they'll relapse and the disease will air its ugly head and then it'll go back into remission. So it'll go back and forth. You have a progressive type where it starts to progress and get worse. And so 85% of people are diagnosed initially with that relapsing remitting type of multiple sclerosis. Now, women are 3 to 4 times more likely to get multiple sclerosis than men. You'll find that 15% of people with multiple sclerosis may have one or more family members or relatives that also have multiple sclerosis. But what's really interesting is that identical twins don't have the same incidence of multiple sclerosis. In fact, if one identical twin has multiple sclerosis, there's 1 in 3 chance that the other one will get multiple sclerosis. How about African Americans? Well, we know, 2 of our loved ones, Richard Pryor's passed away, had multiple sclerosis. Montel Williams has multiple sclerosis. I don't know if you remember, but Michelle Obama's father passed away from complications due to multiple sclerosis in his 30s. But less than 1% of African Americans are affected by multiple sclerosis. In fact, 1 million people in the United States live with multiple sclerosis, but less than 1% are African American. Now, African Americans tend to have symptoms that are limited to the optic nerves and spinal cord. So remember, we talked about the endocannabinoid system, right? We talked about receptors in the eyes, and the optic nerve is one of those nerves that is affected. So we are very excited about how CBD can help with those receptors in the eye. So African Americans typically get something called an optical spinal multiple sclerosis. That means they have more problems with their vision and mobility and coordination versus other symptoms. What are some of the other symptoms? Well, multiple sclerosis, unfortunately, is just like a lot of the other autoimmune diseases like lupus and fibromyalgia and rheumatoid arthritis, right? It can affect many, many different organs and glands in the body. One being the central nervous system. Patients typically are fatigued, they have memory loss, depression, anxiety, unstable mood. They have visual disturbances, double vision. They have speech issues, swallowing issues. They have a lot of weakness, a lot of muscle spasms, ataxia. They have balance issues. They have pain. They have paresthesias. And that's really going to come into play when we talk about how multiple sclerosis patients have sexual dysfunction, right? They have paresthesias where they have numbness even in their genital tract area. They have incontinence of their bowel. They lose control of their bowel. They lose control of their bladder. I've had many patients who have had an indwelling catheter, Foley catheter, because they just have no control over their urination. All of this is because there is a dysfunction in the nerve response stimulus from the nerve to the brain and the central nervous system. So the diagnosis could take sometimes years. You know, with autoimmune diseases, it is very hard to really pinpoint, is this lupus? Is this a stroke? Is this Bell palsy? What is this? So multiple sclerosis is hard to diagnose sometimes. You have to have two separate areas within the central nervous system, which include the brain, spinal cord, and optic nerve, to be damaged to really diagnose. You also want to make sure, again, that you rule out other things that may look like multiple sclerosis, infection, Sjogren's, lupus. Typically, you will get an MRI to diagnose multiple sclerosis. Sometimes you'll have to get a spinal tap, and sometimes they'll use an evoked potential test where they're testing the response when they stimulate a different nerve fiber in your body. What are the treatments? Common treatments are chemotherapy, anti-inflammatory drugs, immunosuppressive drugs, steroids. There's counseling, there's support groups, there's acupuncture, there's physical therapy, there's self-care, physical exercise and diet, right? I can't stress that enough, how you can change the trajectory of your health just with self-care. And then there's a lot of research I found with vitamin D supplementation. Vitamin D deficiency, they're finding, could be a trigger for multiple sclerosis. That's why I take my vitamin D supplements every day. And then there is some advances in medicine with stem cell and even neural repair. So mental health and multiple sclerosis is a real big deal. I lost one of my classmates in medical school. She got diagnosed with multiple sclerosis. It affected her coordination and balance. She ended up starting with a cane, then a walker, then a wheelchair. And it was so overwhelming for her, she committed suicide. So it was that was one of my very first person that I had ever met, African American, that had multiple sclerosis. Beautiful, beautiful girl, very, very bright, but the diagnosis and the symptomatology and the way her life changed drastically, led her to commit suicide. So your mental health is just as important as your physical health. That's why I'm combining these topics with Mental Health Awareness Month. They work hand in hand, taking care of your depression, taking care of your anxiety, when you're dealing with pain. You don't even have to have multiple sclerosis. Just dealing with pain can actually help your pain perception. So that's another reason why CBD, cannabidiol, is so beneficial to people with chronic pain, because it can help with their depression as well. So at this time, I'm going to get out of the way, and I'm going to bring up one of my business partners here at Wakana, Erica Zachary, who is a licensed clinical social worker. She's also a survivor of multiple sclerosis. She's an integrated health clinician. She's a teletherapist, as well as consultant for women with multiple sclerosis. She has and leads a whole support group. I just love it. It's called Black Girls Move. It's an exercise program platform on Facebook for those who live with multiple sclerosis and need to get active. So I'm going to bring up Erica at this time. Erica, are you out there? Yes, she is.
Hi, Dr. Rita. Can you hear me?
I can hear you loud and clear.
Awesome. Thank you. Thank you so much. While you were talking, I was like, oh, I need to go get my vitamin D.
Yeah, right, right.
I didn't take it yet today.
It's for everything. I'm telling you.
All right, so hello everyone. So thank you for coming out today. So Dr. Rita gave me orders. She told me to have fun. And that was probably the best thing she could have told me today, because if you know me, this is so out of my comfort zone. But that's okay, because I had pushing myself at the beginning of this year. I told myself, you're going to say yes to things that you wouldn't normally say yes to. I'm doing a reinvention of me. So thank you, Dr. Rita, for giving me this opportunity. So Dr. Rita already said, so I'm a licensed clinical social worker. I've been practicing for about 25 years now, a little bit over. But I'll talk about my journey with MS first. And so I was diagnosed with MS in 2000. I was diagnosed in 2000, so it's been over 20 years now. And the diagnosis was, it took a long time coming. I was probably having some symptoms of something. I knew something wasn't right for at least 2, 3 years before that. I would go to the doctor, and for a while I was getting, oh, no, nothing's wrong with you. You're fine. You're okay. I think I pulled my medical records later, and people thought I was just depressed. They thought I was just, didn't really know what was going on. I was diagnosed with transverse myelitis first. That was I think in 1999, I was diagnosed with transverse myelitis. And then later I kept going back to the doctor, did a MRI. I refused the spinal tap. I was scared of that. And so based upon my MRI and my just what I was reporting, they diagnosed me with multiple sclerosis. At the time, most of my issues were sensory. Most of them were numbness in my hands and feet, um, and more of that numbness where it's like, not that you can't feel anything, more like your body is falling asleep. So like you have that sensation like your body is asleep. So more like that. I also had muscle weakness in my hands and arms. It was very frustrating to me because I would go to pick up a drink. I'd go out, be out eating. I remember several occasions where I'd go to get something to drink from the fountain, from the soda fountains or whatever they were. And I pick it up, and I had multiple occasions where I dropped it. I thought I had a good handle on it, and I didn't. And so I just didn't have good feeling in my hands, and I had weakness there. And so those were the symptoms I had in the beginning. I had a couple of falls in the beginning, didn't really know why. Just was be walking and would fall. And so I now know that I was having some drop foot issues then that I didn't even really know existed. And so that was the beginning of my diagnosis. When I was diagnosed by my primary care physician. She had sent me to a neurologist, but the primary care physician was the one that told me, I think you have MS. And unfortunately, that was not a great experience for me. When she told me that, she was like, well, so you probably won't be able to work, and you might as well quit your job, go on disability, and you'll probably be in a wheelchair. And no real thought about the fact that I was probably 30 at the time. And so I had an 8-year-old child. I had just gotten married about maybe 5 years before that. We bought a house maybe 3 years before that. And I had just graduated with my master's degree, probably 4 years in between there. And no regard for that. And the fact that, oh my God, what are you telling me? I didn't know anything about MS. I had no idea what that meant. It wasn't explained to me in the beginning. And so I didn't know anybody that had it. So nobody in my family had ever said anything. That I knew no one that had it. So I was thinking, like, where the heck did this come from? I remember sitting in the parking lot after that appointment and crying my eyes out. I called my mom. Because I grew up in New York, so my parents are there. I called my mom. I called my husband. And I remember coming home to him and just crying my eyes out on his chest because I did not know what to do. I did not know what it meant. I didn't know, should I go and just, join a support group, quit my job, or file for disability? What does that mean? Was my husband going to divorce me? Would we keep our house? Like, I had so many what ifs going through my mind. And so I did what she told me to do. I wasn't happy with her with not having the compassion to really explain and understand that she was talking to a 30-year-old woman. But I did what she told me to do. I saw a neurologist. And that was probably the best thing that I did. That particular neurologist was the neurologist that will always stay with me. because he told me at that time, he's like, Erica, you're going to be okay. You're going to be okay. He actually was much more concerned about me becoming diabetic. He's like, you need to change your eating habits. You need to eat. Clean wasn't the word at the time. Now we say that much more often than we did then. But
Right.
he told me at that time, he was like, if you can't pronounce it, don't eat it. And don't pronounce it. You can't pronounce it, don't eat it. Reduce your stress. Okay, what the heck does that mean? I was definitely a type A personality, an overachiever, an overworker, lots of stress in my life. And so trying to figure out what that meant. And he told me at that time to exercise. He said, so exercise, do the best you can, and I started to do that. I did what he told me to do because I was so scared that I would just continue to get worse. And so I started to change my diet. I looked at all the labels. It was really, really just, it showed me that what we're eating, a lot of what we're eating is not food. Like, what the heck is this? And so, even bread, and that's a big deal for me right now. I look at bread and I'm like, okay, bread shouldn't have 20 ingredients in it. It's just bread. So, so it's just very frustrating, but it was very enlightening to me at that time as well, because I realized that a lot of the things that I was eating, a lot of the fast food that I was eating at the time was just not healthy for me. And so I made a lot of changes, but I will tell you, I'll go back because I'll tell you my first experience when I was first diagnosed. When I walked into my doctor's office, I was okay. I was walking fine. I used to go to the mall all the time and take my daughter to the mall at the time. She was a young girl. I used to like to go to the store and buy clothes for her. And so after I was diagnosed, I now know what happened, but after I was diagnosed, I could no longer walk the mall. I could not function. I could not walk up and down the mall. I would have to walk a little bit and sit. And so, I now realize at that time, I didn't think too much about mind and body connections, but it was clearly a mind body connection there. My mind was telling my body, you cannot do this anymore, and I believed it. So we'll talk a little bit more about that again later. But anyway, so I did what the neurologist told me to do. And, so I kept, and, after a while, I started feeling better. Some of the symptoms, I now know it was relapsing remitting MS. And so my symptoms went away. And, for a good 10 years, like I would have like minor things happen, 10 to 12 years, I would have minor things happen. And, for a while, I would tell my husband, these doctors don't know what they're talking about. And I did not take medication. I remember actually the neurologist that first diagnosed me said, I'm not a specialist, so I need you to see a specialist. And I went to a couple of specialist offices, and the first thing that they would say to me is, talk about medication. And so I started reading up on the medications, and, at that time when I was first diagnosed, they were all injectables. I came home with Copaxone. It was an injectable. I put it in my fridge because it was supposed to be, I think it was supposed to be refrigerated, but I remember it had being in my refrigerator. It stayed in my refrigerator for over a year.
Wow.
I just could not do it. I could not do it. And I think that part of that was, one, that doctor telling me, listen, I'm not so concerned about that. Two, I come from a family. My father is vegan. I don't know if he's on this call today, but my father is vegan. Didn't believe a whole lot in medications. And my husband didn't really believe in them so much either. And so we kept thinking positively, and thinking, you'll be okay. You'll be okay. So I never really connected to the medications. And when I started, every time I asked the doctors about what I could be doing, how could I manage my MS naturally, I would not get a response that was saying that that was possible. It was like, well, that's not the protocol. You need to take medications. You need to take medications. But they couldn't really explain to me, if you can't tell me what my prognosis is, and they really don't know. They didn't know, because everybody is different. The one thing about MS is that it's a snowflake disease. So there'll be lots of people. I'm in lots of MS groups now, and we all have some things that are similar, but we all are so very different. Some people function very differently. Just things are very different. So when I realized that they couldn't really tell me exactly what my prognosis was going to be, I really decided to, just try to control it on my own and put more of my faith in God. And so to just try to deal with it that way. And so that's what I did. And then for the first 12 years, like I said, I didn't have a whole lot of symptoms. Now I was probably relapsing, remitting, and me not really understanding that part of it. But I realized later that when I had increased stress in my life, then my symptoms would get worse. I had two incidents that happened to me that really changed that trajectory for me. Both of them were car accidents. One was a car accident, probably in about like 2012. So I was probably 12 years into my diagnosis. And the gentleman was driving with a detached retina, and I was sitting still at a light, and he couldn't see, and he crashed right into me at 40 miles an hour. That part changed how I responded, how my MS was. I just had a flare. I had an exacerbation, and I had a difficult time for a while. I had a lot of more problems with my balance. I had problems, started having muscle spasms, started having vertigo, started having many more symptoms than I had had previously. So I still had the numbness, and that would come and go. I would still have that weakness that would come and go. But now these were new symptoms. These were symptoms that I had not experienced before. And I was scared. I was scared, and I think that somewhere in there too, I started to lose, I did really well with my diet and all of that stuff in the beginning. But I just said to you, I'm an overachiever. I would work a lot. I'd forget what I was supposed to be doing. I'd stop going to the gym. I would start stopping at Chick-fil-A a little more than I needed to.
I love Chick-fil-A.
Me too. I don't eat it as much as I used to, but I would stop more often to just feed my family because I didn't want to cook when by the time I got home. And so I've made some other changes in there too, and they had an impact. So I think that on top of the stress, I wasn't going to exercise as much as I had been before. And so, I had some support systems. Thankfully, I had my husband has always been supportive. My parents, my mom, my grandmother lives with me. So she helped to take care of help me to take care of my children because I had another son later. I had a son when I was, how old was I? 33. I was in my 33. So it was several years in by the time I had been diagnosed with MS. I had it for a while. He didn't know it, but I had it for a while. And so after that car accident, though, it changed a lot. It took me a while to get my balance back, to be able to just keep going because I started having a few support systems that would tell me, Erica, you're going to be okay. I don't know if they're on this call today, but if you are, thank you. Because they were really there for me and it helped me to believe and to remember that that God was still in charge. I do believe that. I believe that He's been directing my life all the time. And so remembering some of the things that I tell other people. Like I said, I'm an integrated health clinician. And so I work with a lot of people with chronic diseases, and I'd have to tell them some of the things that now I had to tell myself. I had to be able to tell myself that you are not your disease and, just kind of fill my own mind with that spirit. So I started to get better after that car accident. Things started to improve. I was able to wear heels again. Not wearing heels was a big deal to me at that time. And so I started to improve, and I changed my diet again. But then I started working for another position. I had said I would never get into management anymore. And I lied to myself because every time I started a new job or a different role at a job, they're like, oh, can you be a manager here or do this? It was some kind of leadership role. And I had a few people that told me, it's probably not a good idea. You need to be able to take care of yourself because they learned that when I'm all in, I'm all in. And so I didn't listen. And I got into another job, stopped doing some of the things I had been doing, ended up having the first car accident that I ever had that I had caused. Yeah, that was 3 years ago now. And was totally devastated. I was in the car with my son. My son was at the time was 15. And I was driving, and my daughter actually had taken me to a doctor's appointment earlier that week because I wasn't doing well. I went to see a neurologist. I told you I didn't really keep the neurologist that I have fired all of my neurologists um, because they didn't really talk to me. I had one neurologist that told me, oh, this medication, you know, your hair might come out. No, you don't understand. I can't lose my hair. No, you're not understanding. So I've always fired the neurologist that I have, but she had helped me to get to one of the neurologists that I was willing to see at that time. And later that week, she was like, well, Mom, still wasn't feeling well. And she's like, do you want me to pick up my brother? And I said, no, I'm fine. I had superwoman syndrome, that I thought that I could do it all. I didn't ask for help. And so I went to get him myself. And on our way home, I hit somebody not once, not twice, because I panicked, because I had never had a car accident before. And now that was the second car accident that I had within a 3-year period of time. The first one wasn't my fault, but the second one was clearly my fault. And so I was in a panic. I had to have somebody come get me. And since after that happened, it really changed. That exacerbation really changed my life, because I had to, I for a while I wouldn't drive. I couldn't drive. Part of it was anxiety. I had a lot of anxiety after that car accident. And then part of it was the fact that I just couldn't trust my body, because I would wake up, and some days I'd wake up and I'd feel okay. Other days I wake up, I have muscle spasms. I started having problems with my eyesight. I had double vision. I had more spasticity than I had ever had. That wasn't a big issue for me before. Um, I started having other symptoms. I had bowel and bladder issues that were a problem for me at that point. And so it changed me a lot. And so I started having a lot of symptoms that, yeah, this is real. But that was just 3 years ago, And so at that point, I decided that I could no longer trust myself driving. I didn't want to harm myself. I didn't want to harm anyone else. And I certainly didn't want to harm my child. So I stopped driving. And so that was at a point too for me that I was like, okay, Erica, you need to, thankfully I was at a job that I could work from the home at the time. I had a job that I had worked from home with for a long time. And so I started seeing a therapist. I started seeing a teletherapist because I didn't want to have to go anywhere. So that was my introduction to teletherapy, what I do now. And so she was working with me to help me to understand my thoughts, because my thoughts were very negative. They were very like, oh my God, I can't take care of my family. It was all the I can't, very negative thinking and a lot of anxiety. And she was like, well, why don't you try to get in the car today? Try to do this, try to do that. And I just couldn't do it. And so after a while, she kept working with me and I started to feel better. And I also started to join the MS community because I had never really done it. I went to one MS support group when I was first diagnosed, when my PCP diagnosed me. And all I saw was wheelchairs and walkers. And, I would do MS walks. And I was like, no, this is not me. I really didn't believe it then. But by the time I had that last exacerbation, it was pretty clear that I needed to do something else. And so I started joining the MS community online. Thankfully found a community of exercisers that has become my second home. It's called the MS Gym, and it's part of the reason why I was able to start the Black Girls Move, because I wasn't seeing a whole lot of people that looked like me in that forum. And so I wanted to be able to, a lot of times, especially with African Americans, we have the tendency to not want to delve into mental health. They don't want to see a therapist. I'm not crazy. You don't want to air your dirty laundry. You don't want to talk to other people, just feeling embarrassed, faith, saying, God, and not making you feel like you weren't strong enough to deal with this. And so I changed that for myself by 1, seeing the therapist, by 2, joining some of these support groups, and by not being complacent, by not talking in the groups, so now I go everywhere and I'm just like very open about what my diagnosis is, because I want people to understand and to have hope that their life is not over because they have MS, because a lot of people feel like it is. And, I had to get there. It took time. But at the same time, I had a lot of support. and where I didn't, where people really didn't understand, I was able to join a community of other MSers that really knew how life was with MS. And so that was having that type of support really helped me. And so, so having that, it was just empowering for me. So, so I just after having that last car accident though, I wasn't able to work the same way. So I was always working from home. But the job that I had been on for at least 12 years, I think it was, yeah, 12 years, had a massive layoff. They had laid off 2,000 people. And so I ended up being laid off. And I had to figure out, I wasn't ready to apply for disability. I didn't really think, I had a mom that worked for, she was a disability analyst. And MS is one of those things that's difficult to prove that you are disabled, because one day you look great, one day you don't. A lot of times people look at you, they feel like you're fine. It's an invisible illness. So people can't tell that you don't look well. I can feel symptoms in my body, but you can't tell it. You don't know unless I tell you. And so I was really bad at asking for help then. That had definitely changed after that car accident. I had to tell people that I need to go here, can you take me? I had to tell my husband, I'm not feeling well today. Can you help me? Or, I wasn't walking well at periods and times, and, I had to ask for help. So it changed a lot about me. It changed a lot of the things that I had to do. It changed that superwoman syndrome for me. I had to start not being that superwoman, not being that person that was always go, go, go. So, so part of that is still there. Some people know that part of that is still there. I now work as a teletherapist myself. After I saw the teletherapist, she told me, listen, Erica, after I lost my job, I did see her again, actually. And she told me, you can do what I do. There's no reason that you can't. I have the license to be able to do it. And so that opened up a door for me and opened up a way for me to continue working and not stop something that I have loved for the last 25 years. And so that's what I do now. So I'm a teletherapist. I really want to help women with MS and people with other chronic health conditions, because I've been doing that the whole time. So just reinventing myself and trying to figure out a way to continue to live a life with MS and continue to live it naturally, because I just wasn't comfortable, excuse me, with the medications. And so it's a choice that each individual has to make. It's not the right choice for everyone, but the medications and the side effects of the medication scared me much more than the disease itself. So it was a choice I made. I'm happy with it. I started seeing I got a medical marijuana card at some point at the end of this, right before I had the last car accident. And that didn't work for me because I was still employed at the time. I couldn't function, couldn't stay awake. That wasn't the right thing. I started working with a doctor of osteopathy at the time, and she was like, well, why don't you try CBD? Kept trying to find products that worked, kept trying to find products that worked. Didn't really happen that way, but I kept trying. And so, so the medical marijuana I started using actually one-to-ones, like CBD and THC products. And those were better, but still took me a little more out of who I am than I wanted to be. Didn't really feel high, but it made me feel fatigued and tired. And so that wasn't the right result for me. So I ended up, I had a cousin that joined Wakana and told me about it and told me about the products. And so, and that's why I ended up here. And so, Dr. Rita, I don't know if you want me to go further into that or you want me to wait.
Wow, what a powerful, powerful, powerful story. Oh my gosh. Erica, thank you so much for sharing. Yeah, I wanted you to kind of stop there and how, you found Wakana, but your story is powerful because it shows how, even though with that diagnosis of MS, that you were determined, and everyone's different, you were determined to take a more holistic approach.
Yeah.
Because a lot of the medications are worse than the diagnosis. And so you took that holistic, natural approach and you continue to reinvent yourself because we know when we're super women, it's hard to shut us down.
Yeah.
So, that didn't stop you. But, I
No.
want to thank you for sharing that. And I want to get into now our products, and then I'm going to bring you back where you can specifically share with the webinar attendees, which products you're using and the outcome that has you've seen with our products. So I want to
Absolutely.
share that information now. But thank you so much. We'll come right back to Erica. That is her information. I'll show it again, her website, her phone number, because we want to make sure that you plug in to her support group and anyone that you may know that has MS. So CBD for MS, yes. So first, the disclaimer that these statements have not been approved by the FDA. If you're pregnant, nursing, on medication, we can't make any claims of diagnosing, treatment. Please consult your physician prior to taking any cannabis product. So we talked about the company and the leadership. We're going to talk about the products that I specifically recommend for those who have not only MS, but any other autoimmune disease states. So the products at Wakana are products you can trust. Why? Because we provide some of the most rich medicinal hemp that's fully compliant with the State Department of Agriculture. Our products are industrial hemp registered, and our products are farm bill compliant, meaning that our products contain the legal limit of THC, which is 0.3% or less. Our products are also double certified, third-party validated, meaning that our products are tested to ensure the highest quality. They're free from mold, mildew, and pesticides. And we also offer certificates of analysis, meaning that each product we're able to show you what's actually on the label is in the bottle. So our products are unique. Our products are potent, they're safe and effective. Well, how do you take CBD in an oil form? It's important to know that there are glands underneath our tongue that actually help to absorb the CBD in the bloodstream. So it's important to hold those drops under the tongue for about 60 seconds before you swallow so it can be absorbed. It takes about 15 to 20 minutes for the CBD tincture to get into the bloodstream, and we recommend that you don't drink, eat, or smoke for at least 15 to 30 minutes afterwards, really to get that optimal absorption. So my recommendation for MS, which is a more serious, chronic, relapsing, remitting sort of autoimmune disease, as we talked about, neurological disease, is our hemp MD. And the reason why is that our hemp MD is a more therapeutic, more potent, our highest milligram product that we have. This is a great product for that type of patient, person, client, loved one, friend that has MS to start with. It's 750 milligrams in a 15 ml bottle. And I always recommend when you're starting CBD to start low, CBD to start low and start slow. So 3 drops twice a day will give you 30 milligrams of CBD on a daily dose. Each drop is 2.5 milligrams. And really that's a great dose for someone who has MS. And then our gummies. The gummies are really good. And let me tell you what the thought process. When you're using CBD, you want to make sure that that level is in the bloodstream continuously. So the gummies come in at night. This is a product that you want to take at night to help you sleep. CBD not only is an anti-inflammatory and an analgesic and help with pain, but it also helps to get in that restorative rapid eye movement sleep, that REM sleep. That's the sleep and the level where your body heals. We also have testimonies that this product helps with the libido. We understand in multiple sclerosis and MS that it can affect the libido. It can affect the vaginal lubrication in women. So we want to help that area as well. So each gummy is 25 milligrams of CBD. So you can tell now if you do 2 drops or 3 drops twice a day, along with this gummy, you're at around 50 milligrams of CBD on a daily dose. So this is a great product. You want to take 30, 45 minutes before you go to sleep. And then the pain, the muscle spasms, the joint pain that MS sufferers endure. A topical product. The Dr. Rita's Rub is a great product. Why? It's our most potent product that's topically used for pain. It's 200 milligrams of CBD along with 19 to 20 other USDA certified organic oils that address inflammation and pain. This product, you only need a little bit, 1 to 2 drops in an area to offer local relief. Again, because this is a full spectrum product and it's topical, it won't pass the blood-brain barrier. So if you do have a drug screen at your place of work and you are looking to address not only MS, but maybe lupus and fibromyalgia, the other autoimmune diseases, you can use this safely and pass your drug screen. And then there's the acute flare. There needs to be a product around for that acute flare that Erica talked about. Using either our vape oil cartridge or our pre-roll are great products to address acute flare. So the onset of action is within 1 to 5 minutes. So let's think about this. You've got the tincture going, 3 drops twice a day. You have the topical to offer local relief. You have the gummy that's going to help you sleep. And then you've got the vape oil cartridge or pre-roll that will address those acute flares. So you're covered for the whole 24 hours. So when one product that you're ingesting starts to wear off, the other one is kicking in. And that's the mindset that you should be in when you're looking at our products. So a vape oil cartridge is 250 milligrams of CBD along with turmeric, black seed, with a carrier oil of MCT coconut. It's a great way to get CBD quickly into the system, along with our Diamond Life pre-rolls. 106 milligrams of CBD. You don't need to smoke the whole thing all at once. Please don't do that. No one needs 106 milligrams of CBD all at one time. But again, it's a fast-acting agent that you want on hand when you're dealing with these autoimmune diseases. And we can't leave out our lube. Why? Because these autoimmune diseases do affect the physiological impairment associated with the lesions in the brain. It will affect the libido. It will affect vaginal lubrication. It will even affect some numbness in the genital area. So we're going to use this lube to enhance the sexual function for those with MS. 400 milligrams of CBD. You use it topically. It's water-based. You can use it with condoms. Absolutely needs to be a part of that regimen. Now, you may be dealing with someone that has urine drug screens at their job, so they may need our broad spectrum product. That's our product that contains less than 0.0% of THC. It's also enhanced with the nanotechnology. That's advanced technology unique to Wakana that helps to drive the CBD into the cells quicker and more efficiently. So it's more available to the cells at 98.7%. Again, more is not better. So 3 drops twice a day will give you 6 milligrams of CBD on a daily dose. Start low and start slow. You can always increase that dose. And then we have our gummies that are in the broad spectrum as well formulation. Now, each one of these gummies is 40 milligrams of CBD. Oh my goodness. These are so good. They're vegan, non-GMO. Again, you want to use the gummy at night to help that restorative sleep, reduce pain, reduce inflammation, and also help with libido. So this is my MS Relief Packet recommendation. These are the recommendations, which is the Hemp MD as a tincture, the Power Gummies, something for acute onset flares, either the pre-roll, the vape cartridges, the Dr. Rita's Rub for your topical, the CBD lube for sexual enhancement, And then of course, if you have random drug screens, then our pure products are products that you can use. So I'm just going to bring Erica back up. She's going to give us the products and her testimony, and then I'm going to open it up for questions.
Thank you, Dr. Rita. Can you hear me?
I can hear you loud and clear.
Okay, awesome. Thank you. So I'm just gonna say I'm real happy. I don't need that lube. My husband will be happy too, but I don't need the lube. Not yet. I'm good. I'm good there. But the products that I do use, I'm definitely a product of the product. I believe in Wakana. The products have been great for me. So I'll tell you what I'm using. So I definitely use. So I don't have the 750 today, so I'm using the 500. So my 750 is all out of. I need to buy some more. So I'm using the 500, and it's something that I use every day, twice a day. I usually use it, and
how many drops do you usually use?
I think it ends up being a full thing. I think it's maybe like 3 or 4, somewhere between 3 and 6. I can't remember how much this thing holds, but I use almost a whole dropper.
Oh, so whole dropper is pretty much close to 8 to 10 drops.
Is it? Okay. Yeah. So it may be a little less than that. It's probably like 6.
Okay. 6 drops. Okay.
6 drops. I use that twice a day, and I'm also using the black seed for inflammation. So I started using these oils. I'm very grateful that you guys, I know that's not on there, but I know it's for inflammation too. So I started using that as well. I told you guys that pain wasn't a real big issue for me. I didn't mention spasticity too much when I was talking, but that became an issue for me after that last car accident. All of these flares that I started having came after that last car accident. And so when I need pain to go away, because I am still trying to work, I really have been, the vape has been my best friend. So that has been my best friend. If I need to get rid of something quickly, it also been my best friend for anxiety. There are days when I didn't realize how much anxiety that I had, and I probably had it longer than I really realized. Presentations like this would have sent me to the bathroom 1,000 times before that presentation. You know, and it didn't happen today. And the vape does me well, so that is a friend of mine. I carry it when I'm out because it will get rid of my pain quickly. And nobody really knows. Nobody knows you use it. You know, I take a couple of pulls on there and nobody knows. You can't smell it. None of that. Okay. I do have the pre-rolls. I will use these periodically. I try to use the vape first, but if I need to use a pre-roll, I will definitely use that as well. And it's really when my pain is bad. And also one of the things that was also happened to me was after that last car accident, somehow temperature changes have impacted my life terribly. And I don't know about anybody else, but in the state of Maryland this year, we have had one day it's 40 degrees, 50 degrees, the next day it's 70 and 80. I'm like, what the heck? And so every day my body feels off. I start to feel real tightness. And so I'm having to use those things more frequently. And at nighttime, I always take my gummy. I did my gummy last night. And I couldn't turn my brain off last night because I was worried about this webinar. So I took a couple of pulls of the pre-roll. I said, Dr. Rita told me to have fun and not to worry. I'm going to bed.
That's right.
I was all good. I was all good. Yeah. So that's what I did. And I just got my power relief today. Yesterday. So I'm going to start using that as well.
So what type of gummies are you using? Broad spectrum?
I use the broad spectrum. Probably shouldn't because they taste too good because then I want to eat more. No, they're delicious. They're great. And they're bigger than that. They're effective, but they taste good. So they definitely help me with sleep. So I use them every night. I was very unhappy because I had run out, and so I got them again this week too.
Wonderful. And what type of topical did you get?
The topical, I have the relief, not the rub. Yes. The liquid. Mm-hmm. The liquid.
Wonderful.
Yep. The liquid.
Wonderful. Yep. Well, thank you so much for sharing with us, Erica.
Yeah, you're welcome.
Amazing. And we're going to take some questions right now, Erica. Let's see if there's someone that
Sure.
has questions. I'm so glad you brought up the black seed. The black
Yeah.
seed is absolutely something you want to add to the regimen for inflammation. And
And I
even
have something that's
you
totally,
said one of your doctors was concerned about diabetes. Is your blood sugar?
yeah. Mm-hmm. Mm-hmm. Well, it was more about losing weight. I wasn't pre-diabetic or anything like that. He just thought that that would be a concern for me if I didn't lose weight, because at that period of time was probably my highest weight. I was over 200 pounds. That wasn't okay. And so he was concerned about that, but I'm not pre-diabetic or anything like that. So,
Wonderful. So
yeah.
let's see if we have some questions in the chat. We want to make sure that you get back to the person that invited you on the call so that that person can get you to your next steps in ordering your products, answering your questions, getting you connected on our Wakana Facebook page. We want to make sure that we get you involved in our movement. But let's see if we have some questions here. Awesome presentation, great presentation. Thank you, Erica. Great presentation. You're amazing, Erica. Oh my gosh, look at all these comments. Great presentation, Erica. Oh, how and why do you use the black seed oil? I think we answered part of it, but how do you use your black?
So
How many?
I use it's like 3 drops, 2 or 3 drops of it's a tincture too. So you put that under my tongue, hold it for 60 seconds before I swallow. That's about
Perfect. And again, black seed is a very, very amazing
yeah,
essential oil that addresses inflammation. It's
inflammation.
an antioxidant. It helps to fight against free radicals. It helps to normalize blood sugar, blood pressure, digestion, kidney function. It's amazing. Black seed,
Mhm.
what doesn't black seed do is what
Yeah,
the
yeah.
question should be.
I used to take the capsules, and those are much better. I
Right.
felt the effects better from the liquid,
Have
the
you noticed
oil.
any benefits to your urinary bladder health with MS is the question.
So I have actually done that. So with the exercise, that has actually helped my bladder a lot. So doing some of the exercises that we do in the MS Gym platform, that has helped my bladder problem. The bowel issue that I had was more like constipation. And so by using the CBD, that helps. And then adding in magnesium, it has helped me as well. And
Perfect.
drinking lots of water.
Yes. So, I always tell people that CBD is not magical, right? You've got to work with CBD.
Yeah.
That's your diet, that's exercise, that's your water, that's your sleep. Those are your
Yep.
other supplements like vitamin D, magnesium, and zinc.
Yep.
Synergy, when you put all of that together, oh my gosh, you see such amazing testimonies from our amazing products.
Mhm.
Um, have you seen improvement in your sight?
I have. So I don't. So I not. I don't. I don't really. I can't say. I don't really know why the double vision stopped. But after I start using the CBD, I don't have that issue anymore.
Right.
So I do have some problems with night vision, but I think that is more related to I had a retinal tear last year, so I'm
Um,
having problems with night vision. I can't see in the dark really well, but that's not MS related.
remember the receptors that are found in the eyes, specific receptors that, research have found with CBD and even those who have glaucoma, right? So glaucoma affects the optic nerve. Optic nerve is effective in MS. So when those receptors are fed with the CBD, what does CBD do? It decreases the inflammation around that nerve fiber. CBD is neuroprotective. So any nerve that has been damaged, that is one of the properties that CBD has. So that's how that works. How much magnesium are you taking, Erica?
Um, they are 200 milligram pills. I know, so I take somewhere between. I take them in the morning. I'm taking like 3 pills in the morning and some like 3 pills at night, something like that.
Got it. Did you discover the Wakana products worked over other brands?
Oh my God, absolutely. So
Mhm.
I was working with my doctor of osteopathy for a while, trying to find a product that worked and to no avail. And so now I didn't realize then that they are not all made the same. So
Right.
having that certificate of analysis, really knowing what's in it, if you're going to get a product, please do that, because I really believe that the products that I was using before didn't have CBD in them, or wasn't available to my body. It wasn't bioavailable. So I understand it much better now. So we definitely have products that work. They're working for me, and I told you I'm a product of the product. I can't run out of my products. Gotta
And
stay in there.
so there are some other questions. It's 9:05. I'm going to let everyone go because I want you to contact the person that invited you so we can really move you forward. We can get you on our Wakanda Facebook page. We can get your questions answered specific to products. We can get your products ordered. I want you to email any questions that you have to Erica. You want to give them your email? Is
Email.
your email down there?
Sure. It's you can, let me do it simply here. Ezach, EZACH 1268 at gmail.com.
Okay, so this is not it that I put on the screen.
Oh, it's that too. I'm sorry. It was harder for me to say, but yes, empowerulbd@gmail.com.
Okay, so
That's my business email. That's fine.
you see her email. Please email these magnesium questions to her and any other questions that you may have about her MS support group, her platform, her Black Girls Move exercise, empowerulbd@gmail.com. It's right there on the screen. Her phone number is 888-599-7199. You guys have been amazing. We had 122 people on this
Wow.
webinar tonight. We want to see you next Wednesday evening. We're going to talk about something. I don't know what it is yet, Erica, but we'll figure it out before next Wednesday. Have a great evening. Contact the person who invited you on the call, and we will see you next week. Thank you again, Erica. You were fabulous.
Bye. Thank you
120
guys.
people.
Thank you.
Yes,
Thank you.
outstanding.
Awesome. Thank you, Dr. Rita.